Hello everyone. In today's video, we are going to talk about kVp and mAs. This is very important for you to know for your registry exam. So for the technical exposure factors, we do have the parameters that we select on the machine, which is your mA, your exposure time, your kVp, and then we also have source to image distance or SID, which is an important factor as well. All of these have a major influence on the final X-ray image, and they can affect image quality, patient dose, and the overall radiographic outcome. Now we're going to talk about milliampere or mA. This will give you a brighter image. So for your mA, this controls the number of X-ray photons that are produced. It directly influences the image brightness or density. So whenever you think of mA, just try to correlate it to image brightness or density. Higher mA, it does give you more photons, which results in a higher and brighter image. For mAs, when mAs is increased, the receptor exposure will increase. When mAs is decreased, the receptor exposure will decrease. And also mAs directly controls the number of X-ray photons that will emerge from the patient. At the end of the video, I will link um, other videos that I've made where I have like practice test questions and answers, and it quizzes you on mAs, kVp, and other X-ray physics. So just click on that video at the end of this one. For mAs, it's going to be a unit that represents the product of the X-ray tube current, which is your mA, and the exposure time in seconds. It directly affects the quantity of radiation produced and the exposure of the image receptor. This does have an effect on patient radiation dose. An increase in mAs will increase the radiation exposure to the patient. So whenever you decrease mAs, it will decrease the radiation exposure to the patient. Also, mAs controls how much radiation is used to create an image. If you are finding these videos helpful, could you please like, share, and subscribe for more videos? Now we're going to talk about exposure time. This is also very important. For your exposure time, this determines how long the X-ray tube is energized. This affects the total number of photons produced. You have your mA and time combined. This is going to be your milliampere-seconds or your mAs. And then you have your mA and time, which is going to determine the total exposure. So are you all at a point where, I'm sure you all are at a point where you are selecting your kVp and mAs by yourself, and then the technologist is checking behind you. And then we also have AEC, which is going to automatically adjust your technical exposure factors for you. But it's still good to know your kVp and mAs, because there are times where, let's just say, AEC isn't working for the day and they have to get like a service engineer to come out and fix it. So in that case, it's important for you to know what kVp is for a chest, what kVp goes for a hand, and we'll get all into that later on in the lesson. So just let me know in the comment box if you are familiar or okay with kVp, or is it something that you cannot decipher the difference between kVp and mAs. So I'll get to kVp later on in just a second. Now we have our kilovoltage peak, which is your kVp. This is the difference between light and dark areas. So when you think of kVp, just think of darker areas. Whenever you think of mAs, just think of like a brighter image, brighter areas. Kilovoltage peak, or kVp, influences the energy and penetrating power of the X-ray beam. Higher kVp equals more penetrating X-rays. So it will have like an increase. And then for your image contrast, that will be affected. You have your differences between light and dark areas. Another trick you can do to remember your kVp and mAs numbers, because it's still good to know, even though we have AEC now, you can have like a small notebook, and you can start with the most common x-rays that you take, and you can write down the kVp and mAs range for chest, because we know chest x-rays is common. We know hand, feet, um, extremity x-rays is common. Abdomen x-rays is common. You can start by writing down the kVp ranges and mAs ranges for those, and then get familiar with it just in case, let's say your instructor comes to your clinical site and quizzes you on it. Okay, so we're still in kVp. This is going to control the energy or quality of x-rays that are produced. So you have your mAs that is controlling the quantity of photons, but your kVp is going to control the energy. kVp determines the energy of the x-ray beam, which impacts image quality and patient dose. So also just remember, kVp is going to control that energy of the x-ray beam. It also controls the penetrating power of the x-rays. So kVp, just think of something like as an energy source. The effects on kVp when it comes to our images, a higher kVp, it does create a higher energy x-ray, so this will penetrate more effectively. And then your lower kVp, it will give you higher contrast images, which have more visible differences between your tissues. Also, a higher kVp, this will increase the amount of scatter that is produced, which is going to reduce the image contrast. Therefore, it's going to decrease how your image is looking. So think of this, whenever you have lower kVp, it does not have a lot of scatter that is producing. That's why you have a higher contrast image, which is a better image because you can see more of the tissue. But whenever you have a higher kVp, you won't be able to see as much because higher kVp, higher energy is producing more scatter to the image. So I hope that makes sense for you. So this is like, you can see the differences between the kVp settings and the mAs. This image is from researchgate.net, so courtesy to them for this image. And then for figure A, you see how the image is kind of like brighter. You can see it well. The kVp range for this image is 75, and then you have it at 19 mAs. For figure B, you really can't see as much. It's a little darker. Like you see the image, but it is a little darker. The kVp range is at 85, and then your mAs is set at 12. So we can see from this image, from this example, that a lower kVp is giving a better contrast or a better quality image. Now we have our 15% rule whenever it comes to kVp. So whenever you see 15%, correlated to kVp, that goes with kVp. So a 15% increase in kVp can be compensated by having the mAs. So you'll just cut the mAs in half. Also, it maintains a similar image receptor exposure that is very important. An increase in kVp by 15% will cause the receptor exposure to double. A decrease in kVp of 15% will halve the receptor exposure, so it'll cut that in half. Now we're going to dive in a little bit to your SID, which is your source to image distance. We'll talk more about SID probably in like another lesson. This is just going to be like an like the basics of SID, like a general overall, which is going to be determinant and correlating to your distance. So source to image distance, or SID, is the distance between the X-ray tube and the image receptor. 40 inches, which is more commonly used for like your extremities, your table x-rays, your supine abdomen on your table, supine chest. If you have a trauma patient and you're doing your clinicals in the hospital or you're working in a hospital, we do sometimes supine chest x-rays, especially if the patient, we're moving them over onto the table for like trauma hip, or if they have like a lot of x-rays, then we just put them on the sliding board, move them to the table. And then you also have your facial x-rays, which is done upright. So that would be like another example of the 40 inches for your SID. And then for 72 inches, we have upright. We most commonly have your PA and lateral chest x-rays. SID does affect your image sharpness and magnification. Image quality is increased when SID increases. The exposure to the image receptor is reduced as a result of this. Now we have our Bucky factor, also known as your grid factor. For your Bucky factor, this is, like I was saying, also known as grid factor. Just in case you see one or the other, just know both of them is the same thing. A grid is used to reduce scatter radiation from reaching the image receptor. The purpose of the grid is to absorb scatter radiation or scatter X-rays. So it's going to absorb all of those scattered X-rays that is coming from the patient. Image contrast is improved whenever the grid is used. A higher exposure is required to compensate for this, though. All right, so that was a quick lesson for you. Please give the video a thumbs up. If you would like more radiology physics video to help you prepare for your X-ray registry exam, please give the video a thumbs up and hit the subscribe button for more videos. And I look forward to reading your comments. If you all would like more physics video, just let me know which area of the test that you will probably have more problems with, that you are struggling with, and I can try to make videos to help you all get through those tough lessons. Well, thank you all for watching, and bye.